All right, so there's a saying in radiography where they always talk about diagnoses and the radiographer. So you always hear them talking about diagnosis and the radiographer, diagnosis and the radiographer. So we just want to interconnect these two sayings. So when they say diagnosis and the radiographer, what do they actually mean by this saying? So diagnosis and the radiographer, is just so you know that radiographers, they play very important roles in the various diagnoses that occur in the hospital. So their responsibilities are different from other physicians. Okay, so while radiographers do not make medical diagnosis directly, they help to what? Confirm it. I don't know if you understand. The doctor will now, from the medical history and the physical examination, the doctor is suspecting something, so he writes it. But it's when the radiographer images, that's when they now get to see the right thing that was wrong. So in other sense, the radiographer didn't primarily make the diagnosis, but they confirmed it. So image productions, the radiographer is now operating using all those x-rays, CT scans, MRI, ultrasound. So they're ensuring that the patient is being positioned properly. They're ensuring that the patient is not being exposed to too much energy. They're ensuring that what the images they are getting from the patient is of high quality. Making sure that the images are clear and everything. Okay. So clinical input is what the radiographer there knows the same anatomy that the physician knows, the same pathology that the physician knows. So combining the knowledge of what radiography and pathology and anatomy, they are able to now confirm a particular diagnosis. Okay, so they also help to make sure that what the patient comes first, making sure that every procedure that is being performed, the patient's welfare is put on the top list. So they balance diagnosis quality with safety. They communicate clearly to the patients. They also communicate clearly to their colleagues. They also communicate clearly to the other doctors in the hospital. Okay. So what radiographers do not do is what? They do not provide diagnosis to patients. Interpretation of images is a responsibility of radiologists or other qualified physicians. Radiographers may recognize abnormalities but must not disclose them. They only send the result back. The person that will talk to the patient is different. Okay. So the contribution to the diagnosis is they actually bridge between the patient and the radiologist. So they provide very good images that will now help to now finally confirm that this patient, this is what is wrong with you. Okay, so that's the meaning of this terminology in case you have heard it anywhere.